I'd like to say that it's an environment that focuses on making the most of living, managing symptoms and individual comfort and the care of relatives. It can be an uplifting experience at the same time as being supportive to the patient and family through a difficult and sad time. We all work together as a team to care for the patients and their relatives holistically.
And it is well worth coming. Do make the appointment, but if you do think you're heading towards a hospice, come and have a look, because I can assure you it's probably nothing like you expect. And I think one of the most wonderful bits of Terry's interview was where he described having the jacuzzi and the bubbles and the nurses dancing in to Beyonce and entertaining him. I thought that was absolutely lovely. Nettie, you have sat very quietly. I think it's time we asked you some questions. Sarah emailed in, and this I thought was a really good question, and I guess it might have been one I would have asked. I don't want my family to have horrid memories of my death. How can we avoid this?
Well, I think it's a really important question, and open communication is the key really to this. It can be very difficult because diseases and illness trajectories can be very uncertain. So like Terry, some people come in and then they actually do quite well and have a period where they have a better time and they get home and then they might need to come back. Other people come in not expecting to die and deteriorate very rapidly and then die, and that can be very difficult. And the key to that is that we have open communication with the patient and their families, so that they can do planning as best they can, and that is a really important thing.
It's all about conversation, isn't it? All the time.
All the time, and being open and honest, and being able to say that we're not sure, or we don't know, or we think this might be happening, so we can do planning as best we can.
And one of the interesting things actually listening to you both is that, and people don't necessarily understand this, it's not just about a conversation with the patient, is it?
No, it's including the whole family, because often it's the family that are worried. Sometimes the patient actually is quite serene and accepting, a bit like Terry, and it's the family that have the worries about how things are going to be, and it's important. We can't always give black and white answers, but it's important that we try to answer all questions as best we can. Every little worry that they have, if we can alleviate some of that, they'll be better prepared for what's ahead and feel better supported. We can't stop death, we can't stop people dying, but we can give them information and support which enables them to cope with what is happening.
And that leads on, in a way, to the other question for you. This comes from Myra, who asks, what help is there for my friends and relatives after I've died? I worry more about them than me, because they're the ones who've got to cope with my death. I'll be gone.
And this again is a really common worry. So often patients come in and their biggest worry is my wife, my husband, my partner, my children, and how they're going to manage. So for me, I'm one of the nurses, but I'm also part of our support team, and we give emotional and psychological support to patients and relatives along the whole process of the journey. It's not always easy to know where we're heading, but if we can talk with them and give them support, then that enables them to cope. After, we have a bereavement team who support patients or support relatives so that they can have support counselling if they need it after the death.
I think this is really important, because I do wonder if people sometimes see a hospice and think it is only about the person who's coming in to the intensive care bed. And we're proving that's just not the case, is it?
No, in actual fact, the families is as important as the patient. Often the families struggle more sometimes coping with what is going on than the patient. So it's important that we give them support.
Well, I can't thank you enough, both of you, for giving up some time to talk about this subject and to answer these questions from people who have watched what Terry had to say and had questions of their own. So thank you to Bernice, Senior Staff Nurse, and to Nettie, Staff Nurse and a part of our patient and family support team here at Cornwall Hospice Care. To find out more, there are two things you can do. You can visit the Dying Matters website, and all you have to put in the search engine is Dying Matters Week, and up it comes. Or visit our website, Cornwall Hospice Care, and you can always get in touch with the hospice too if you have questions that you want to ask. Thank you very much indeed, and a big thank you to Terry, whose story we've shared with you this week. Thank you.